Hello and welcome to the CompendiRx Long COVID webinar series. This is the second in our summer series as we're in the beta testing phase of launching the website. So thank you for joining us and supporting our efforts to provide practical resources for the millions worldwide who are impacted by long COVID, as well as our ongoing research efforts. So really appreciate you being here. My name is Melanie, and I'll be the moderator for this session, Practical Approaches and Specialized Perspectives with Dr. Jacquie Leone. And a quick introduction for Jacquie. So Jacqueline Leone is a naturopathic doctor who is also board certified in holistic nutrition. Dr. Leone, or as she goes by with her patients, Dr. Jacquie, holds a BA in psychology, a doctorate in naturopathic medicine, and board certification in holistic nutrition. In addition to practicing medicine, Dr. Leone has developed and currently teaches science and nutrition courses for a nationally accredited institution. She specializes in chronic illness, gastrointestinal dysregulation, inflammatory conditions, and mental health. Her unique approach combines the wisdom of Eastern medicine with the technology and science of Western medicine, offering an integrative approach heavily focused on functional medicine. And she is committed to sharing these life-changing insights with the world. Thank you for being here.
Thank you for having me. Hello. Hi, everyone. Okay, so let's just go ahead and get started. So I'm Dr. Jacquie. Welcome to Promising Treatments for Long COVID, a functional medicine approach. Next slide, please. So let's get into exactly what long COVID is. And eventually I'll get into a little bit about functional medicine so we kind of understand philosophically my approach versus standard conventional medicine. We're going to touch on a little bit of the physiology as to what's happening with long COVID, or at the very least, what we're theorizing is happening, because it's only been 3, not even 4 years, right? So science is sort of catching up into studying something like this. And then we'll investigate a handful of treatments that seem really promising right now with the small amount of research that has been done, in the feedback from people who are seeing really great results. So first and foremost, what is long COVID? So PASC for short, post-acute of SARS-CoV-2 infection. So it's essentially you had the acute infection and now you're experiencing symptoms longer term. Maybe some did improve, some completely went away, but some are still lingering or have gotten worse. And so it can continue for weeks, months, or even years. I mean, most of the studies that are out now, people are having symptoms for 2, 3, 400 days, which is over a year. So it's a multi-system effect. It's happening everywhere, where some infections are simply GI oriented, neurologically oriented, maybe upper respiratory, but we're noticing with long COVID, multiple systems are having symptoms, and it includes both physical and mental and emotional. It can look like mental health issues, physical issues, and neurological issues. Next slide, please. So these are some statistics that are really important to understand the profound impact of long COVID, why it's so important to study, why it's fantastic that companies like this are really passionate about educating people, because it is new and emerging and it's making such a big impact. So 65 million people worldwide, and even more. Statistically, I've seen studies anywhere from 65 to 72 million worldwide. 20 to 23 million Americans are affected by long COVID symptoms. The most common age group we see is 35 to 49 being affected, although all age groups are affected. Women, slightly more than men, almost double prevalence of men for whatever reason. And nearly 75% of the people who have long COVID have strictly limited day-to-day activities. So they can't work as long. Caregiver, being a parent, is being affected. Exercise is being affected. Sleep, just their day-to-day activities are chronically limited. And 20%, 1 in 5, have significant impacts, like not able to work at all, requiring having to file for disability, having to get additional caregivers for their children and families. So it's a really big deal. And it's estimated that 3 to 4 million Americans aren't even able to go to work. So what kind of impact is that having economically, right? So we're utilizing all of these healthcare benefits and then tapping out and still unable to return to work. So people are losing their jobs, and then companies are losing the workforce. So it's a big impact across the board for everyone, even people who aren't directly experiencing long COVID, they're experiencing the impacts to some degree indirectly. Last but not least, the inconsistent standards for diagnosing, because there's no biomarkers. I can draw somebody's blood and let you know that you have high cholesterol or diabetes or an infection, but I can't do that for long COVID. And so it's kind of this nebulous criteria of signs, symptoms, severity, chronicity, and there's no gold standard quite yet. And we're kind of working to develop that. So that's why it can be such a struggle for some patients to be taken seriously by some healthcare providers, because again, we can't point to a specific issue and say, yep, this is long COVID. There's no question. And that brings me, last but not least, the treatments. We don't have a clear treatment. We know that certain bacteria are vulnerable to amoxicillin, let's say for, an antibiotic. It's cured, it's gone, you're not infected anymore, you move on. But we don't have that consistency of care. We don't have that direct pharmaceutical or supplemental remedy for long COVID. And so science is still trying to catch up to the virus itself. Next slide, please. So with no FDA approval, we're basically just trying to learn all about the systems that are being affected. And in functional medicine and naturopathic medicine, we like to look at the root cause, right? Instead of the branches of the tree, what's the trunk of the tree? Where's the roots of the tree? And these are all the systems that are affected. We do know this. So in terms of mental health, people have no symptoms of mental health issues, and now all of a sudden they're having severe anxiety, depression, not able to get out of bed, or having severe panic attacks, which is mirrored in the nervous system issues. So the nervous system not working appropriately, neurotransmitters and things, which obviously, two sides of the same coin, the nervous system and mental health. Memory, concentration, fatigue, the loss of smell and taste is commonly known as a COVID symptom, migraines and headaches. And then you'll see in all systems, things like blood clots, the blood disorders down at the bottom left, because blood clots form. And so when that happens in the brain, that's a stroke. When it happens in the lungs, it's a pulmonary embolism. When it happens in the heart, it's a heart attack or an MI. And so it's system-wide, because the cardiovascular system, or the highway, the blood system, is being affected. The nervous system, which is the composer to a great degree of all of the other systems, is being affected. And last but not least, the lymph, which is the immune system, or, all of the network of lymph nodes is being affected, and they all run concomitantly. So next slide, please. So before we get to lymph, blood, and nerve, which there's a really great slide here, I really feel like visually, a lot of people are visual kinesthetic learners. Let's really touch on the functional medicine approach, because the philosophy is a little bit different, right? So there was a really great, I'll never forget in medical school, this analogy that one of my professors taught us. If the sink is clogged and the tap is on and the sink is overflowing, flooding the floor, are you going to stress yourself out trying to mop up the water on the floor, i.e. manage the symptom of the problem? Or are you going to walk over, turn the sink off, and address the clog in the sink and address the problem at its root issue? And so in medicine, that's the whole goal of functional medicine and naturopathic medicine. What's causing all of the things that are happening downwind? And so we work to address that root cause of disease, peeling back the layers and seeing what can happen when we look at what's triggering that domino effect of sorts. So it's really complex sometimes because there's so much at play. So genetics is our blueprint. It's what we're born with. And to a great degree, we can't really control genetics by and large. To some degree, we can. It's known as epigenetics. It's the environment that we create for that gene to function, right? So we could have the gene for addiction, but if we never drink or use drugs, for example, we might not ever trigger that genetic coming out. And so we don't experience alcoholism or drug addiction, even though we have a genetic predisposition, for example. And that's by and large controlling the environment, which is the next point. An environment is internal and external, and lifestyle hinges greatly on environment, because internally our environment is our stress levels, how much cortisol we're releasing, for example, our gut microbiome, or the nutrients that our tissues are utilizing to function, which is diet and fluid intake. But we also have external environment that our body is constantly contending with, right? So we have sun exposure, UVA, UVB rays. We have our air quality. We have our water quality. We have, things that we're breathing in, putting in and on our skin, for example, down to deodorants and lotions and makeups and hair products and all of these things that our body is constantly exposed to. So internal and external environment. And then lifestyle obviously leans on that. But lifestyle is also things like stress tolerance. What is your unique work environment, your relationship environment? How do you sleep? Do you exercise? These are really important factors that go into, again, creating the environment for the genetic code or the blueprint of your body to function. So we consider all of these variables in functional medicine and naturopathic medicine. So it's very personalized. So your average medical visit with most, conventional doctors might be 7 to 12 minutes on average, where I'll, for example, do an intake, take an hour to an hour and a half with a patient to understand their history, to understand their triggers, to understand a lot more complexity of their whole picture, because it has to be so personalized, because we're working under something known as biodiversity, or the diversity of a person's unique biology. I mean, we all have a heart that pumps blood and a brain that thinks thoughts and has a nervous system, but the physiology or how it works, some people, they beat faster or slower, or think faster or think slower, or are more or less sensitive, right? So anatomy being similar, it doesn't always reflect in our physiology and our biochemistry, which is very diverse. And functional and naturopathic medicine really focuses on honoring that diversity and meeting that diversity where it is. And it's really helpful with a lot of complex conditions like long COVID, because symptoms in chronic illness, especially long COVID, vary so widely among people. Sometimes it's primarily neurological, sometimes it's primarily cardiovascular or upper respiratory or GI. And so you can have 20 patients walk in with long COVID and their symptom list all be unique. And so we need to address that uniqueness among each patient and each person. Next slide, please. So that being said, functional medicine definitely does not work on symptom management. So if you look in the red, that's more conventional medicine by and large. Not all conventional medicine physicians. I mean, there's a different tool for every job, right? If I'm losing blood and I need surgery, or I have a master infection and I need IV antibiotics, or I need a medication like insulin injection to manage my diabetes and save my life, you better believe I'm going to manage my symptom. You better believe I'm going to rely on that tool, right? But for functional medicine and naturopathic medicine, by and large, we're looking to prevent that chronic illness and prevent the necessity of that pharmaceutical, if possible. I mean, I write scripts all the time when people need it, but if I can work to lay down a foundation of health and work on that middle line you're seeing right now, the immune stimulation, the signaling molecule or chemicals, which lead to chronic inflammation, that's really, to me, the target of what I do a lot in practice, because you'll see that middle line being what leads directly into the cascade of having symptoms, damage to tissues, and then a diagnosis of a chronic illness, right? So the things in blue are really what functional medicine and naturopathic medicine focus on. So foundational health. Foundational health and inflammation are kind of inherently linked, because foundational health, or sometimes lack thereof, can really make us vulnerable to certain things like infections. I mean, you touch a doorknob, 10 doorknobs, shake hands, touch random surfaces all the time. They're covered in things like staph and strep. So how are you not chronically ill? Well, you have an immune system to protect you. You have a certain level of foundational health, but not everyone does. Some people are more vulnerable. Maybe they have autoimmune disease. Maybe they have chronic inflammation constantly happening because of their environment, their lifestyle. Maybe their blueprint is off, right? Because those are those three factors we talked about. So foundational health is really what kind of makes you vulnerable or stronger, more vulnerable, less vulnerable to exposure to infection. So what can we do to address foundational health? Well, first, limit oxidative stress. And we'll talk about what oxidative stress is in just a minute. And then the anti-inflammatory, that's the AI, the anti-inflammatory 80-20 diet with a focus on protein. So 80% of the time, we want to focus on whole foods, non-processed foods, and then 20% of the time, eat whatever you want. Because if you deny yourself your cravings or the pizza or the beer or the, you know, chocolate donut, I mean, you're probably going to at some point overcompensate and just throw it out the window because it's not sustainable. Life is meant to be enjoyed. But if we're enjoying life at the exchange of our health and putting ourselves in a chronic disease state like obesity, heart disease, type 2 diabetes, then it's not really enjoying life. Really, it's robbing ourselves of a quality of life and our longevity, to be honest. So the good balance, biochemically speaking, where we can feed the body, support health, but also enjoy it, right? And have our treats every now and again is the 80-20 rule in most cases. Getting high quality sleep, 7 to 9 hours a night uninterrupted, ideally. Exercising around 180 minutes a week when possible. That's, about 3 hours, however you want to chop it up. Daily walks or 3 hours a week at the gym, just being active is important. Hydration, water, and then electrolytes on top of water to make sure that the hydration is driving into the cells, into the tissues, and we're not just urinating it all out. Good hygiene, right? Foundational health is important. We learned that in COVID with the big wearing the masks, washing your hands, keeping distance when somebody's sick, making a community responsibility, not just for yourself, but for those in your community by staying home when you're ill, or infectiously ill, where people can catch what you have. So hygiene is really important. And then last but not least is supplements, herbs, and lifestyle therapies. And those are kind of unique to each person. Taking a probiotic, maybe some magnesium to help with muscles and sleep, multivitamin for some people, iron if you're iron deficient, for example, lifestyle therapies like getting body work done when you have fibromyalgia or you have trigger point pain or you have osteo or rheumatoid arthritis. It depends on the person and it depends on your health picture, what you would need to fit that. But all of those work together to both limit inflammation and create a nice foundation of health. And from there, you can't help getting infected to some degree. I mean, you can with the foundations of health, but we are humans. We do have an immune system. We are out and about in the world, exposed to things all the time. So if we do get an infection, what can we do or what happens next? Well, our immune system is stimulated, okay? And then to basically call out the helpers of the rest of the body, we send out these signaling chemicals. So let's say we cut our arm, okay? And, or we get sick, either one, good example. The immune system says damage is being done. Something is here. Bacteria is in the upper respiratory tract, or damage has been done to these cells. So how does the body communicate? It can't call on the phone like you can tell your friend, like, hey, something's wrong, I need help, come over. So what they do is send signaling chemicals in the form of, you'll see in the last and all the way to the right, the histamines, the cytokines, these are inflammatory cells. These basically say, hey, something's off, I need help. Come send these cells to clean up debris, to kill things, to engulf and kill. Send B cells so that you can make an imprint and remember that guy for next time. So next time we're sick with it, we aren't sick as hard, as long, or as severely, right? Sending other cells to start cleaning up the damage, not just fighting the bad guys away and preventing infection, but now how do we rebuild the damaged tissue, collagen and fibrin to skin cells, mucosal lining and cells to epithelial cells to the inside of the nose or the respiratory tract. So those things are constantly happening through signaling chemicals. It's like a big game of telephone throughout the body, but with chemicals. And that creates that inflammatory reaction, things getting red, things getting swollen, us producing mucus, getting a fever, right? Inflammation, by and large, especially acute inflammation, is a fantastic tool that's necessary for health, right? It gets us out of the woods, it heals. But the problem is when we introduce multiple inflammatory pathways simultaneously. Let's say we're eating the standard American diet, full of processed sugar, no nutrients, no vitamins or minerals, lots of processed carbohydrates, lots of saturated fat. So our body's got to focus on that inflammatory fire. Then maybe we have a really stressful job, or maybe a toxic relationship that we're dealing with. Maybe we have unstabilized mental health, and to the process of everything that's happening, everyone. So those signaling molecules or chemicals turning into that inflammation over time, let's say it's dietary inflammation, let's say it's stress inflammation from increased cortisol and stress, right? Financial stress, physical stress, whatever it is. Let's say we're not exercising, so we're not getting that cardiovascular system moving and things detoxifying, right? Let's say we're drinking to manage and cope, or smoking, or in a highly polluted area, or not drinking water, right? That means we're now fighting 6 inflammatory wars, and then we get exposed to COVID or a virus, and that's just the straw that breaks the camel's back. Okay, so foundational health, immune system health, addressing inflammation, and really working on helping manage those signaling molecules. These are all the things we're going to talk about when we start addressing the treatments in just a minute. But first, I think for me in practice, a lot of my patients and a lot of my students really value understanding the why. Because when we can understand what's happening in our bodies and we can visualize what's going on, a lot of times we feel more empowered to want to take action. We can, be more consistent with our care, be more patient with our body because we understand it a little bit more. And so I really like to try to always add a piece of education, and the mechanism of what's happening before just throwing a lot of practical treatments. Because when I explain the practical treatments, I'm like, this is an anti-inflammatory and this works on histamines. We'll understand what that means. So first and foremost, understanding the process, like we just talked about. Your lymph system, you'll see, is just a big network of nodes. That's why, they get filled with white blood cells, fluid, debris, and can get stuck when they're fighting infection. That's why, the doctor will feel your neck and like, oh, do you have swollen lymph nodes and your tonsils and things like that? So that's a sign of infection. And they work very intimately with the circulatory system, the blood and lymph exchange, because the bad cells have to be delivered to the veins to be, taken away to get filtered. And then the good oxygenated, nutrified blood from the arteries or arterioles have to deliver some of those good things to the lymph so that the lymph system can fight the infection, and then it can off gas or dump the bad stuff to the veins to be, filtered, and the new stuff. And so this exchange is constantly happening. And next slide, please. To be able to tell the body, the blood and the lymph what to do is the nerves. So this is a page from an anatomy book, but it basically just shows you all the intimate relationship of all of the things happening. So no wonder when you get an infection, you might have nervous system stuff like severe fatigue, brain fog, aches and pains. The nerves are telling the whole body, hey, we need rest. And the blood, maybe you have like tingling in your fingers and toes, cold fingers and toes, you're having your blood, headaches, nausea. Some of these symptoms it's obviously related to blood flow issues, right? So long COVID being a stimulant to the immune system, trying to fight something off, but now the highway of the body, the blood system, and the nerves, the conductor of the body, are all affected because they all run so intimately close to each other. They're all parallel and intertwined. So this is a big theory behind why long COVID affects multiple systems, is because it's not just one of the highways being affected, it's all of them being affected to some extent. Next slide, please. So oxidative stress, I mentioned this in the slide before. Now, what's happening inside the lymph node? What's happening inside the blood? Why is oxidative stress important? I've heard all about it and it causes inflammation, but that just sounds foreign to me. So you'll see the free radical, okay, in the top left. The free radical is basically a unbalanced molecule or atom. And so it doesn't have an electron. It's missing an electron. So it's unbalanced. It's kind of like having a flat tire. The car is not balanced. It's like, when the washing machine gets off kilter and it starts making that loud clanking sound, things that are unbalanced are unhappy, right? So free radicals come from UVA, UVB rays, smoke, alcohol, processed sugar, the immune system fighting the good fight, medications, toxic air quality, even products we put on our body, dryer sheets, perfumes, all of these things create free radicals. And our body, does have systems in place to balance out and address the free radicals. But what's happening, especially now, is we're doing too much free radical addition and not enough neutralizing it. So these unbalanced molecules or free radicals are so unhappy and they go around and they're just damaging our healthy cells, our DNA. And that damaged cell tries to do its job and replicate, but it's mutated now. So what does it do? It makes a mutated replication, and that makes another mutated replication. And before you know it, we have tumor and cancer cells. And now we have tissue damage, all because these angry free radicals are going around causing damage to otherwise healthy tissues. So how the heck do we keep these free radicals from damaging everything? And you can kind of see in the bottom left with oxidative stress. Oxidation happens in nature with any carbon containing anything, really, like food, us. We're all carbon based. So apples will turn brown. That's a form of oxidative stress, or these free radicals damaging the healthy flesh of the apple and turning it brown, right? So that happens inside of our body on a regular basis. So when it happens too much, too often, that creates that inflammatory cascade. So how do we neutralize it? Well, antioxidants, right? They're going to address oxidative stress because they're antioxidants. So I like to think of antioxidants as like the Oprah of electrons. When Oprah's like, and you get a car, and you get a car, and everybody gets a car. So the antioxidant just has so many extra electrons to share, and they're very willing to share. So you get an electron, and you get an electron, and every unbalanced, unhappy free radical gets an electron, and now they're balanced, now they're happy, now they're neutralized. They can be carried out of the body through stool, sweat, urine, and just leave us alone, and we're left nice, healthy, and protected, right? And so it neutralizes these free radicals and protects our cells and our DNA from being damaged. So oxidative cells are cells that are under lots of oxidative stress. You can see just aren't working appropriately. They can't function to the degree they're intended to, and they can't replicate healthily. So what happens with long-term oxidative stress is inflammation. And then you see here on the right side, the cancer occurs, diabetes, you get allergies, you can have immune function disorders, you age a lot more prematurely, quickly. You're shaving years off of your life. You get neurodegenerative disease like Alzheimer's and dementia, inflammatory bowel issues, cardiovascular diseases, all because of oxidative stress. Because oxidative stress, again, inherently leads to inflammation, i.e., the body playing that big game of telephone, asking the immune system and corrective systems for help. This oxidative stress accumulates, the inflammation is trying to fix it, but it's not fixing it fast enough, and then chronic illness occurs. Next slide, please. So between the oxidative stress and the inflammation, what are the game of telephone chemicals? What are these signaling chemicals, and why are they important? Well, one of the most important are cytokines. These are like the interleukins, the tumor necrosing factors of the body, and they signal, you can see at the bottom, leukocyte or white blood cell recruitment, like, hey guys, let's all go fight the good fight. Come on. They're recruiting these groups of white blood cells to do their job. They're, fighting bacteria. they're doing everything that the immune system is built to do. But when we're causing too much damage over time, you're drinking every single day, you're smoking a pack of cigarettes a day, you're in a terribly stressful job all day, every day, you're maintaining some level of trauma in your life, releasing high levels of cortisol, which can degrade you. You're not getting sleep. You're not exercising. The food you're eating is highly processed and causing more and more inflammation that your body has to release these cytokines to try to keep you balanced and keep you healthy. So what happens over time, it starts with like, maybe you're getting sick a lot, more fevers, depression, you're not able to gain weight or keep a healthy weight. Maybe you gain too much weight, right? You're experiencing aches and pains and swelling and bloating and fluid retention like edema. Eventually you're getting arthritis and colitis and these GI issues, tissue damage, skin problems, and eventually we see the shock and the organ failure. And so long COVID is associated to people getting sepsis and having shock and passing away. Acute COVID as well. That's, a huge problem and why it's so concerning to a great degree, because these cytokines and these messengers or signaling chemicals are being released at such high amounts that there's just no way that the body's natural defenses can keep them neutralized or at that healthy level you see in the chart, right? For physiological manifestations and diseases occurring. And cytokines are unique because they cross the blood-brain barrier. And so cytokine storms are highly linked to severe depression, psychosis, nightmares, sleep disorders, anxiety, and panic attacks. And so we really want to focus on driving those cytokines down, getting them at a more manageable level when people have long COVID or just chronic illness in general. Next slide, please. So it's very important. And when I talk about the treatments, when we understand cytokines, that's what I'm talking about. Another signaling molecule is a histamine release. And we know this associated to allergies, right? And I'm going to talk about a couple antihistamines that do address and have been shown to significantly help long COVID symptoms, which is great. So why is histamine important? Well, histamine is released in the blood system and especially mucosa. H1 histamines are for upper respiratory. H2 is for the mucosa of the gut. So that's for like ulcers and inflammatory reactions to foods we eat or at the GI level. So the H1s, which COVID affects primarily because it's a respiratory virus initially, it basically, when it's released, it's going to dilate our blood vessels to hopefully get more nutrition, more white blood cells, more of the good stuff to the area, right? Too much histamine is going to cause blood clots. It's going to increase your heart rate. You're going to get swelling. Just think of any time you have seasonal allergies, your face swells, your mucosa cells, everything hurts and is tender in your sinuses, your lungs, maybe it's harder to breathe. You get adrenaline release because your body's trying to address the issue. It's in that fight or flight and it's trying to fight off the bad thing. So what we notice is a histamine intolerance in people with long COVID, and they have really high levels of histamine being released even 3, 4, 5, 8 months after having the acute infection of COVID. It's like the histamine never got the signal to turn off. And so it's continued to be released, and people with long COVID are having similar issues to what we see when histamine gets out of control or histamine intolerance. Next slide, please. So this brings me now to understanding, now that we understand inflammation, we understand oxidative stress and the importance of antioxidants. We understand cytokine release, we understand histamine release because those are the signaling molecules. Now we can kind of understand the treatments a little bit better. So first we have NAC, N-acetylcysteine, and the anti-inflammatory diet. Now I put those two together. I'll talk about them in different order of the presentation, but I group them together because the mechanism of action is the same. They're highly antioxidant. They're the Oprahs of electrons, right? Handing everybody electrons. And they're anti-inflammatory because by neutralizing those free radicals and minimizing that oxidative stress, we're preventing inflammation from occurring or getting too far out of hand, right? And then NAC also supports the body's natural processes of making its own chemicals to fight off that oxidative stress. Then we have the antihistamines. So we talked about histamine reaction. Hydroxyzine, Fexofenadine, they're different classes of histamines. And so we'll get into how they work and why. Blood sugar regulation is metformin. A lot of us know that as like a type 2 diabetes medication to manage insulin resistance and stabilize blood sugar levels without having to become insulin dependent or injecting insulin. So we'll talk about why that's important in long COVID and why that's working. Naltrexone is more of an analgesic. It's an opioid antagonist. And so it's going to help. The biggest impact it has is helping with significant pain that people are experiencing, similar to fibromyalgia. And last but not least, oxaloacetate is a naturally occurring substance in all cells. It's a supplement and it's mitochondrial support. So we all know the inside joke from high school biology that the mitochondria is the powerhouse of the cell, but what the heck does that really mean, right? It essentially means it's the gas tank to the cell. So just like your car can't drive without fuel, right? It can't function. The cell can't function without the mitochondria. So if there's mitochondrial damage from long COVID, or oxaloacetate is really low, for example, from the diet or just from the body in general, maybe genetically, biochemically, what we notice is the mitochondria not functioning as well as it can. And that's when we get things like that fatigue, that lethargy, that can lead into body pain and the depressive type symptoms. So next slide, please. So let's go ahead and jump right in to all the treatments. First and foremost is N-acetylcysteine. Originally, it was used clinically to address acetaminophen overdoses and as a mucolytic to thin out mucus of people who had bronchial spasms and just increased mucus in upper respiratory infections. It boosts the amino acid L-cysteine, which is the precursor to glutathione. And that's a lot of fancy ways to say it increases the body's biggest antioxidant. The Oprah of electrons, well, we have an innate one. We can eat them in foods, which we'll get to in the dietary aspect, but we also have them in our body naturally in the form of glutathione and SAMe. And so N-acetylcysteine helps that entire pathway and feeds that pathway to create more. It gives us the raw ingredients we need to be making more of our own internal antioxidants. So that's how it addresses free radical damage, oxidative stress, and lowers inflammation. And it's great because it's a multi-route administration, which means if people have trouble swallowing pills, like the elderly, for example, or you can get an IV, you can do inhalants. And so there's a lot of delivery systems to help a lot of different types of patients. Next slide, please. So let's get into, I'm not going to get into a huge, mechanism. This is just for my science people out there who love it. But essentially, you can see it's a direct antioxidant and an indirect antioxidant. So directly, it actually binds to things in the body that are causing oxidative stress. And then indirectly, by minimizing the redox reduction oxidation process and increasing glutathione. So it's helping on both ends. And then obviously the anti-inflammatory route by increasing those all of those cytokine productions. It suppresses the high levels of the bad ones and increases the ones that are going to help repair. So you see here, you can see from the picture, it suppresses tumor necrosing, interleukin-1, interleukin-6, which are all triggers for inflammatory processes that we see in long COVID and chronic illness in general. So, and then again, toward the bottom, you'll see oral, IV, and inhalation. So lots of different ways to administer. Next slide, please. So it's a really fantastic supplement, very well tolerated. And this is just the biochemical cascade in terms of long COVID specifically. So we're infected with the SARS-CoV-2 infection. It decreases our ACE2 because that's where it's binding, right? It's increasing, angiotensins, all these things happening in the body. We're increasing that oxidative stress or those free radicals, right, that are damaging our healthy cells. And this is where NAC comes in and says, not on my watch. And that's where it's going to really work to regulate and minimize that oxidative stress, the endothelial damage, and everything downwind. So we don't get the platelet activation. It's preventing it. It does act as a mild blood thinner. And so it's preventing those blood clots from forming, which we saw earlier on in the symptoms of long COVID. we're protecting the entire highway of the body, the blood system, right? So cardiovascular health improves, lung function and oxygenation of the blood improves, blood-brain barrier, or, nutrients getting to the brain and the nervous system improves, all because of NAC. And this is where it inserts in the pathway. So next slide, please. And this is the dosage. This is what right now studies have found between around 600 and 1200 milligrams, depending on the severity. To the left, you'll see kind of the COVID. This is acute COVID because it works with both. So I thought that it was important to mention. If we can apply it during acute COVID, sometimes we can prevent the severity of long COVID or long COVID from happening at all. On the right is really right now what studies are showing. 600 milligrams are significantly reducing those inflammatory markers, ferritin, CRP. We know C-reactive protein is a big indicator of myocardial infarction, cardiovascular health. The higher the CRP, the more likely we are to have a heart attack or, complications in the cardiovascular system. So driving that number down is key to long-term health, preventing things like long COVID from affecting the cardiovascular system. It's reducing shortness of breath or dyspnea. It's reducing mortality rate and hospital stay, like the length of a hospital stay and the mortality happening associated to long COVID. Respiratory failure is down. The need for mechanical ventilation and death is all down when on 1200. Now that one is 1200 milligrams IV. Blood oxygenation, again, decreased CRP, decreased length of hospital stays. Oral and IV administration actually suppresses the replication of the COVID virus. And so when we can give it, because the inhalant is kind of more localized, but if we're giving oral, which is, absorbed systemically through the gastrointestinal tract, or even better, an IV, which bypasses digestion and goes straight into the bloodstream, now we're able to actually suppress the binding of the SARS-CoV-2 to the ACE2. So when the binding doesn't happen because NAC is binding instead, now the replication can't occur, right? So that was a huge finding. And then Yale just actually published something in the last year that found that 1 to 2 milligrams of guanfacine plus the 600 milligrams of NAC together are improving memory, organizational skills, people's ability to multitask again, getting back to work, doing executive functioning, managing the household budget. A lot of people reported just feeling like themselves again in terms of being able to manage their own lives. And the brain fog had been completely resolved, not just impacted positively, but completely resolved, and they were able to resume their normal lives again. So that is very promising. Next slide, please. So NAC is a really great opportunity. I do, for every treatment, I did include side effects, contraindications, and interactions because I think it's important. I'm not really going to stay too long on these slides, but I will say it's very well tolerated. It's highly, the safety is high. Nobody had terrible side effects. Side effects were really mild. It's very affordable. It's very easy to access as well. You don't need a prescription for it, which is nice. And children can use it, which is fantastic. So just be aware of hypotensive, antiplatelet, anticoagulation drugs when taking NAC, because again, it does have a blood thinning effect. So if you're going to have surgery in the incoming weeks, or you need your blood to be clotting for some reason, or if you're taking something that's thinning it, it's going to, work to potentiate that even more, which is sometimes what we don't want. So just be aware of that. Next slide, please. And now we're going to move on to low-dose naltrexone. So I mentioned before, it's an opiate antagonist. Traditionally, it's used to treat narcotic and alcohol dependence. It really does help prevent the physical pain associated to the nervous system, detoxing from such highly addictive substances, usually given anywhere from 100 to 500 milligrams in. So, when treating addiction. So when it comes to long COVID or immune related issues, that low dose naltrexone is used. We're looking at below 5 milligrams in most cases. So it really helps address the brain inflammation in particular, and the physical pain. So it helps with the immune dysregulation, brain inflammation, and physical pain. Next slide, please. So we'll kind of see how that mechanism of action works. You can see the clinical uses down at the bottom, long COVID being on that list. It's a really important because it is reducing those inflammatory cytokines that I mentioned before, those signaling molecules that are screaming out, telling the rest of the body, I need help, I need help. So the tumor necrosing factor alpha, interleukin 6, interleukin 12, it can cross the blood-brain barrier. And so it does help again with that brain fog and the brain inflammation issues, the cytokine storms that can happen. Like I said, because cytokines can cross the blood-brain barrier, right? And that's that depression, anxiety, mental health, and psychosis stuff. So naltrexone is fantastic to help with that, as well as nerve pain. And you can see the natural alternatives, NAC being on that list. And if you go to the next slide, pretty please, we'll see what science is showing. Oh, okay. Well, this is more of the biochemical pathway. I just love pathway. I think mechanism of action maps. So low dose naltrexone, we can kind of see at the bottom what it's doing, enhancing immune function, improving inflammation. It's healing corneal ulcers. That's just kind of one example of how it can heal and help with the synthesis of epithelial cells and things like that. Again, with Crohn's disease, with helping epithelium in the gut. And now the next slide, please. Now, this is really what studies are saying. Brain Behavior and Immunity, the Journal of Brain Behavior and Immunity, released a lot of great studies. Highly recommend checking them out. But 1 to 3 milligrams per day for 2 to 3 months saw large improvements in the limitations of day-to-day activities. People were able to go back to work. People were able to manage the household better, increasing in energy levels, decreasing in pain, brain fog lifted, concentration, even just having a day-to-day conversation to problem solve, whether at work or personal life, sleep improved, joint pain, upper respiratory things like bronchospasms, coughs, shortness of breath, chest tightness. And again, because we're really driving those cytokines down in the blood-brain, in the brain, we're seeing improved mood and stabilization, like lack of irritability, just feeling better overall in their own body and in their mind, their mental health improving. Next slide, please. And the next slide discusses the combination of both the low-dose naltrexone and the NAC that we just discussed. So those two together were actually studied as well. And the largest improvement in that study was decreased body pain. So the aches, the pain, the fibromyalgia type, can look like fibromyalgia, but it's actually long COVID. These two together help significantly with the pain, the fatigue, sleep disturbance. And again, the energy and concentration just kind of went through the roof, and it's consistently across the board. So it does look really promising. If your long COVID patients or people pain and brain issues or mental emotional issues are the biggest, this can work great concomitantly with the NAC. Now, I will say the low dose naltrexone, once stopped, some symptoms can return because it's not really addressing the root cause per se. It can drive down those cytokines, but if the immune system is continuing to make more, we really want to work on that immune system function, and that's where the NAC comes in. So the two used together is really great because we're addressing two sides of the same coin. We're getting people feeling better now with the low dose naltrexone, and we're really reaching into that root cause, preventing the oxidative stress and addressing the inflammation with the NAC. So next slide, please. And then this is just like the side effects, things to look for. Just like SSRIs that are intended to treat depression can sometimes cause depression, low dose naltrexone can actually sometimes cause or exacerbate what it's intended to treat. So just be aware of that. If you yourself are going to try it as a treatment, or if you're a physician listening and you're going to try it for your patients, just be keenly aware and kind of monitor closely, especially the first few weeks, as you're kind of seeing how the body reacts. Next slide, please. And this is the contraindications, liver issues. Obviously, if they're an active addiction, please don't utilize it. Have blood disorders. Don't drive or operate heavy machinery because it is an analgesic and it does kind of affect brain function. Initially, it's a painkiller. It's similar to methadone. So it should not be used in pregnancy unless absolutely necessary, i.e. an addict trying to, work on things, or if the quality of life or the long COVID issues are threatening the pregnancy. Obviously, it's, when the pros outweigh the cons, but by and large, if we can prevent it during breastfeeding and pregnancy, please do. And then the list of drug interactions you can see there: opioid and pain or cough relievers, because again, it's going to potentiate those things, because that's kind of what it's intended to use or do. So anyway, next slide, please. That is low dose naltrexone. And now we're going to move into the antihistamines. And I know I'm going fast, but I just have such limited time and I want to make sure we get to all the slides. So antihistamines, again, we have H1 and H2. H1 is upper respiratory antihistamine. H2 is more for the gastrointestinal tract. So we're going to focus on the H1s just because long COVID, yes, we see GI disturbance with long COVID, but a lot of times that upper respiratory stuff, cardiovascular stuff, loss of smell and taste, a cough that's lingering for a year. So, and that's really what we're noticing these two they're able to address by and large. Also the fatigue aspect of it. But hydroxyzine, Fexofenadine. So hydroxyzine is a first generation antihistamine, and it's highly sedative. So if you want to sleep, it's highly recommended. If sleep disturbance is an issue, this is something you probably want to take before bed. Fexofenadine is non-sedative. The trade name, I believe, is Allegra. So, it's a second gen when people were complaining, oh, we're falling asleep at our desks. This is really the day-to-day one. It gets people back at work, back functioning. So let's kind of look at the differences between them in the next slide. So histamine intolerance is kind of what we talked about on the histamine slide. Cells create and release the histamine, and they attach to certain target cells. They deliver the message, trigger the response. Hey, make more mucus. Hey, make more inflammatory cells. Hey, make more white blood cells to fight off this thing. And then our body creates these enzymes that naturally neutralize them. And they're like, hey, you did your job. Thank you so much. You're good to go. You're off work. You can clock out. And that process just continues to happen. Well, what happens in histamine intolerance is too much histamine is released, so too much of the signaling chemical in long COVID at least, or our body, whether genetically, environmentally, or for whatever reason, produces the neutralizing enzymes. So we're making too much of the trigger, histamine, and not enough of those neutralizing enzymes. So you can kind of see that disparity, and that creates that histamine intolerance. So histamine is released in all these different body systems. I mean, look at the list here. In your immune system, from mast cells and basophils. Basophils are a type of white blood cell. In your nervous system, in your digestive system. And so it's no wonder that people with histamine intolerance due to long COVID and the long COVID symptom picture, histamine intolerance, long COVID symptom picture, they look very, very similar, right? Very similar systems are being negatively affected. It's a variety of body functions. Histamine helps to regulate digestion, sleep, blood pressure, brain function, sexual function. And is it any wonder that these are all similar to long COVID symptoms? I don't think that that is a coincidence. Next next slide, please. So this is kind of just showing you the mirror of histamine and what it affects: blood system, right? Lungs or your pulmonary system, cardiovascular, GI. So again, it's a mirror image here. And so a lot of people with long COVID will have histamine intolerance or high levels of histamine, which is why we're seeing antihistamines working really well. Next slide, please. So hydroxyzine in particular, you can kind of see from this picture, SARS-CoV-2 always wants to bind to the ACE2 receptor site. And what hydroxyzine does is it gets in there and it binds instead. And so it's going to prevent the SARS virus from binding. And so it competes for it. And so by doing that, it's direct antiviral activity. It prevents the replication and the binding, which is fantastic. So that is why hydroxyzine is so helpful when it comes to long COVID symptoms and why some people are having complete resolution of their symptomology. So doses between 25 and 50 milligrams a day have been noted to have significant improvements. Exercise intolerance is back up because now people can breathe. Chest pain is down, fatigue is down, brain fog is down, reduced mortality and hospital stay lengths, because again, the virus just can't replicate because hydroxyzine got to the ACE2 before it, right? And so it's preventing that binding and that replication. So that's why we're seeing almost complete resolution of symptoms in some people. Again, biodiversity, everyone. So there's not going to be a one size fits all, but for the people that hydroxyzine helps, it really, really helps. Next slide, please. So here are some side effects and precautions to consider. Again, it is an antihistamine, so we all kind of know the side effects of allergy meds. You're going to get tired, you can get blurred vision. It can kind of slow things down. You might feel confusion. If you feel any of the more severe side effects or your patient reports that, obviously have them stop immediately because we don't want to put them in harm's way. Don't use machinery, don't drink alcohol. If you have kidney problems, bleeding problems, liver problems, cardiovascular health conditions, obviously see a qualified healthcare professional to make sure that this is something that fits your specific health picture and won't aggravate any conditions that you might already have. Next slide, please. And then contraindications and drug interactions. Again, pretty similar: heart problems, family history of heart problems, medications that can cause drowsiness if you're, drinking, using illicit drugs, sleep or anxiety medications, other antihistamines or muscle relaxants, because again, they're going to in some way potentiate the actions of those things. And we don't want to depress the cardiovascular system too much. We don't want to knock people out, in terms of the sleepiness. And we just don't want to overstimulate that system in the body. And so obviously avoid those drugs. Next slide, please. So now we're going to talk about, I think next slide.
Okay.
Yeah.
Oh, yeah. Can I just say just really quickly, Jackie, I'm sure you noticed the time. There's about 4 minutes left and there's one question. So just letting you know.
No. Okay, thank you. No, I didn't know the time. Okay, so really quickly, Fexofenadine, 180 milligrams, reducing brain fog and GI disorders, more regular heartbeat. Next. I really want to get to, side effects. You'll see those. Let's keep going. Oxaloacetate. So this is that mitochondria. It helps in the Krebs cycle, making energy, reduces inflammation, helps neurogenesis, i.e. new neurons forming. So it actually helps heal and create new neurons where neuron damage has happened, and it helps manage blood sugar. Oxaloacetate with the blood sugar and metformin with the blood sugar stabilization. That's going to help prevent fatigue because now your body can utilize your blood sugar to make energy now. And it's actually taking it into the cell to use it for energy. Next slide, please. So this is just kind of the mechanism of action. It helps mitochondria, increases energy production, protects the brain, all that good stuff I just talked about. Next slide, because I really want to get to dosage. So 1,000 milligrams a day or 500 milligrams twice a day for 6 weeks. That's when we started noticing improvement, and specifically long COVID and just chronic fatigue syndromes. It is in daikon, radish, squash, and tarragon in terms of food. So if you want to increase those in your diet, you'll get them naturally. Otherwise, you will have to supplement if you want to try. But able to tolerate sound, lights, interactions, conversations, just quality of life, getting back to work. Oxaloacetate was great for all of those things, that quality of life, energy production, and the brain fog part. It's really, really impactful there. Next slide. Then we're going to talk about side effects, contraindications. So if you want to take a screenshot or if you want to watch the recording and, get into the details here, just be wary of what to look for, what to avoid. And then next slide. We should be moving into metformin. Metformin is the glucose drug. It's more for type 2 diabetes. When we can manage our blood sugar, we are managing inflammation. When we manage inflammation, we can help prevent long COVID symptoms. Next slide. I want to get to the dosages, but this is just a picture of how it helps. Look at all the systems metformin helps. When our blood glucose is at a healthy, manageable level, everything else works. Lowered inflammation, low white blood cells, lowered blood pressure, instead of high blood pressure. And again, all the systems that we're seeing in long COVID being affected, metformin helps address and improve the function of. Next slide, please. I'm going so fast. I'm so sorry. Okay. 1,500 milligrams a day for long COVID. It reduced COVID incidence by 41%. Big deal. Viral load was down 4 times lower when people were on metformin compared to when they weren't. We don't know the mechanism exactly. We just know it works right now for some people. Again, biodiversity. Next slide. So things to consider, side effects, look out for B12 deficiency and low blood sugar, and all these GI things. Next slide, contraindications and drug interactions. So if you're on any of these medications, or have a history of kidney, metabolic acidosis, liver, all that stuff. Next slide, please. And then I already talked about this, so I'll graze over anti-inflammatory diet. But essentially, we want to reduce the chronic inflammation and give the body the Oprahs of or electrons, right? All those antioxidants. The best way to get antioxidants is eat the colors of the rainbow, people. Make sure half your plate, at least 2 out of 3 meals a day, are as colorful as possible. And all of those colors offer different antioxidants for different body systems, right? So the blues and the purples are great for the immune system. The reds are great for cardiovascular. Yellows and oranges are great as antioxidants in general because it's vitamin C, citrus things, right? So please, please, please eat your colors. The more colors, the better. Next slide, please. And there's a quick image of what to eat and what to avoid. And then we should get to the questions and wrap up. I'm so sorry for going over.
That's okay. Yes, there's lots of thank yous for the detailed and clear presentation, but also I'll just put this question in because maybe it'll, you'll be able to
Absolutely.
incorporate it. Someone asked what strategies we can adopt to maximize incorporation of antioxidants within the body.
Okay, fantastic. So first you want to remove the obstacle to the cure, as we say in naturopathic medicine. So just remove things that cause oxidative stress. So wear sunscreen, stay out of the sun when possible, drink clean water, avoid polluted air, use clean products, no parabens, phthalates, sulfates on the body. Try to avoid processed sugar, alcohol, smoking cigarettes, using recreational drugs. I think the next slide might have like a list of things to avoid and add. So these are, and then all these foods will add antioxidants, colors of the rainbow, healthy fatty fish, omega-3s, healthy whole grains. This is a perfect picture if you want to take a screenshot. So these foods cause the inflammation and oxidative stress, and then these foods fight them. So that's the dietary aspect. And then I mentioned some of the lifestyle things like the drinking and the smoking. And number one is stress. We're addicted to stress in America and just in the Western world. So if you can learn to turn it off and manage every time you become stressed, do something to de-stress, that's really going to be key, and almost more curative and important than diet and lifestyle is going to be your ability to manage your own nervous system. So hopefully that helps. Do we have a second question, or is that the only one?
That was the main question. Yeah. So
Great.
thank you.
Thank you so much for showing up. Thanks for listening and staying so long. I really appreciate everyone's attention. I hope that the long COVID sufferers got some practical tools, some things to try, some things to look into, and some things that will really help so you can get back to a quality of life that works for you, get out of pain. And to any clinicians and researchers, I hope you felt inspired today to help any of your long COVID patients, or delve into some of these topics, because we really need your help to really make an impact for people who are suffering. So thank you so much for taking the time, everyone. I really appreciate it.
Thank you so much, Dr. Jacquie. That was really, really fantastic. And thank you everyone for joining us and attending. And just to mention, the next webinar will be Monday, August 12th. And that is going to be pharmaceutical sciences, drug development, and long COVID. And that's at 12:30 p.m. Eastern time, presented by Chinoso Akano. And apologies if I don't say your name correct, who is the PharmaD principal medical scientist at Gilead Sciences. So thank you
Yay.
again for everything and anything.
That'll be
There's more
great.
information on the CompendiRx platform. So please stay tuned for more. Thank you, Dr. Jacquie.
Thank you.